EP 33, How to Manage Stress and Anxiety Naturally After 60. Stress and anxiety don't disappear with age. For many older adults, they intensify. Health concerns, financial worries, loss of loved ones, changing roles, and the awareness of mortality create a unique stress landscape in later life. And chronic stress is not just uncomfortable, it is biologically damaging. It accelerates aging at the cellular level, raises blood pressure, suppresses immunity, disrupts sleep, impairs memory, increases inflammation, and raises the risk of heart disease, depression, and dementia. But the natural tools for managing stress are powerful, well-evidenced, and more accessible than most people realize. Today, we're covering what chronic stress does to the aging body and the strategies that genuinely work. When you perceive a threat, physical or psychological, your body activates the stress response. The hypothalamus triggers the release of cortisol and adrenaline. Heart rate rises. Blood pressure increases. Glucose is released into the bloodstream. The immune system shifts into emergency mode. This response is brilliant in short bursts. It helps you respond to genuine danger. The problem is when it becomes chronic, activated repeatedly or continuously by psychological stressors that never fully resolve. Chronic cortisol elevation causes hippocampal atrophy, shrinkage of the memory center of the brain, increased abdominal fat accumulation, suppression of immune function, elevated blood pressure and cardiovascular risk, disrupted sleep, accelerated telomere shortening, a direct marker of cellular aging, and increased risk of depression and anxiety disorders. In older adults, the stress response is both more easily triggered and slower to recover than in younger adults, making stress management especially important after 60. The single fastest and most accessible stress reduction tool is controlled breathing. It works because slow, deep breathing directly activates the parasympathetic nervous system, the rest and digest counterpart to fight or flight, within seconds. Diaphragmatic breathing. Breathe in slowly through the nose for 4 counts, allowing the belly to expand rather than just the chest. Hold briefly. Exhale slowly through the mouth for 6 to 8 counts. The extended exhale is the key. It is the exhalation that activates the vagus nerve and triggers relaxation. Practice for 5 minutes daily and use it on demand whenever stress spikes. Box breathing. Inhale for 4 counts, hold for 4, exhale for 4, hold for 4. Used by military and emergency personnel for rapid stress management in high-pressure situations. Highly effective and requires no equipment. Progressive muscle relaxation. Systematically tense and release muscle groups from toes to head. Releases physical tension that accumulates with chronic stress. Particularly helpful before sleep. These techniques are free, have no side effects, and work within minutes. The research supporting their effectiveness for anxiety, blood pressure, and cortisol reduction is extensive. Mindfulness, paying deliberate, non-judgmental attention to the present moment, has more clinical evidence behind it than almost any other psychological intervention for stress, anxiety, and depression. Mindfulness-based stress reduction, developed by John Kabat-Zinn at the University of Massachusetts, has been studied in hundreds of clinical trials and consistently shows significant reductions in perceived stress, anxiety, depression, and cortisol levels. It also produces measurable structural changes in the brain, increasing gray matter in areas associated with emotional regulation. You don't need to sit in silence for an hour. Starting with 10 minutes of guided meditation daily produces measurable benefits within 8 weeks. Apps like Insight Timer offer free guided meditations specifically for seniors and beginners. Mindful walking, paying attention to the sensations of walking rather than ruminating, combines the stress-reducing benefits of both movement and mindfulness. A 20-minute mindful walk in nature reduces cortisol more than the same walk done while checking a phone. Exercise is one of the most powerful antidepressants and anti-anxiety agents available, with no prescription required. Physical activity reduces cortisol, increases endorphins and serotonin, promotes neurogenesis in the hippocampus, and improves sleep quality, all of which directly counteract the biological effects of chronic stress. The dose matters. Even 20 to 30 minutes of moderate aerobic exercise, 3 to 5 days per week, produces significant improvements in anxiety and stress levels within weeks. Yoga and Tai Chi have particularly strong evidence for anxiety reduction in older adults, combining movement with breath awareness and mindfulness. Gardening, dancing, swimming, and brisk walking all count. The activity you enjoy and will do consistently is always the right one. Loneliness activates the same stress pathways as physical pain. Social isolation in older adults is associated with elevated cortisol, increased inflammation, accelerated cognitive decline, and significantly higher mortality. Conversely, strong social connections buffer the stress response. People with robust social networks recover more quickly from stressors, have lower baseline cortisol, and show better health outcomes across virtually every measure. Investing in relationships is not a soft, optional lifestyle choice. It is a direct stress management strategy with profound biological effects. Sense of purpose also modulates the stress response significantly. People who feel their lives have meaning show lower cortisol reactivity to stressors, better sleep, and better immune function. Volunteering, mentoring, creative work, community involvement, any activity that provides genuine meaning is a stress management tool. Sleep and stress are bidirectional. Stress disrupts sleep, and poor sleep amplifies stress reactivity. Prioritizing sleep hygiene is simultaneously a stress management strategy. Nutrition affects stress biology directly. Magnesium, deficient in most older adults, regulates the HPA axis, the brain-body stress pathway. Omega-3 fatty acids reduce the cortisol response to stress. Excess caffeine amplifies anxiety. Alcohol, despite feeling relaxing initially, disrupts sleep and increases anxiety the following day. Time in nature is one of the most underrated stress reduction tools available. Even 20 minutes in a natural setting measurably reduces cortisol and heart rate. Sunlight exposure regulates the circadian rhythm and serotonin production. A daily outdoor walk combines exercise, nature, and light exposure, a triple stress reduction dose. Chronic stress is not inevitable. It is not simply the price of a difficult life. It is a biological state that responds powerfully to specific, well-evidenced interventions: breath, movement, connection, mindfulness, sleep, and time in nature. These are not complicated or expensive. They require only time and intention. And the return on that investment in energy, mood, health, and longevity is extraordinary. If anxiety or stress is significantly affecting your daily life, please speak with your doctor. Effective treatments are available, and asking for help is a sign of wisdom, not weakness. See you in the next video.